Hello, Laurie. Welcome
Hello.
to hpd.com.
Thank you.
It's a pleasure to have you with us
Pleasure
today.
to have you.
Laurie, I have this is the second time that I've got to meet you and hear you at the Academy. First at the ICR event in way back in 2010, and sorry, not at the ICR, the Homeopathic Research and Charities event in 2010, and now again we meet here. I've seen your cases earlier,
Nice
and
to see you.
it has been a wonderful experience to see how you explore your patients, how you go into their depth. Tell us a bit more about your experience with working with your patients using the sensation method.
Well, using the sensation method has been a great tool, because it, for me, has enabled, or not enabled, but given a map for going deeper and going deeper. Many times I think many of us would go deeper in a case taking, but what to do with that when you do go deeper, what to do with that kind of information. And what the sensation method has done has given us a way of knowing what to do with that information, giving us a way to evaluate it and then making it usable. So that's been a tremendous gift in terms of the sensation method. A certain kind of fulfillment that comes.
Yes. In general, people who do not follow sensation method, there are often misconceptions that practitioners who use sensation method, they prescribe on traits, animal traits and plant traits, and the prescriptions are often shallow, often unproved remedies are used. What is your experience about all these myths and misconceptions?
I know that's true, that there are a lot of misconceptions. I do think it is a tool, like any other tool that we have, and like all those tools, when they're applied the right time, with the right kind of intent, with the right kind of skill, I think it brings you what you want. If the situation doesn't call for it, then you have a bag of all sorts of different ways of going. And I think the big thing is being able to assess when and where and how to apply all those various techniques that we have to move in, and to have that flexibility so that you can respond and you can move in the way that the patient directs you. I think the misconceptions, I think you're right, there have been some pretty remarkable kinds of prescriptions made in the name of the sensation method. What can I say about that? It's like homeopathy. If it, how can I say it? If it works and it's true, then it'll last. If it doesn't work, then what's going to happen with those prescriptions is that they're going to come back to the practitioner and they'll have to go at it again. So I think that perhaps there was a time where some exploration was being done. But I think it's getting to the point where that tool has a certain maturity now, and it is being able to be applied with more skill, more maturity, more precision, and I think it's taking people to less of these unusual prescriptions, shall we
Less
say.
of these unusual
I think so, because the idea of the sensation method was not to go to these unusual places. I mean, you can take the sensation method and have an insight into something as simple as pulsatilla, but it's the whole experience of that pulsatilla case becomes so dynamic. It's not a list of symptoms that you're putting together. You've gone to the bottom and you've experienced this vital sensation, and the patient has experienced that vital sensation, and there's a then all the expressions seem to come out of that. So it's not necessarily these way out unproven remedies.
So the synergy that we are talking of about nowadays, especially with this new work of Dr. Sankran, the synergy of homeopathy, was this synergy always there, or is this an evolution?
I think the synergy was always there. And it is an evolution, isn't it? I mean, to be able to articulate it and to be able to express it so clearly as is being expressed now. But basically, I feel like the synergy has always been there. A combination of, like that foundation of organon, repertory, materia medica, principles of practice, all that was always the foundation of the sensation method. So that has been its precursor, and I think it's now just even more finding its place of integration.
When did you got connected with the sensation method? What was your point of connect with it?
You mean timing? I
Timing?
don't really remember
What
the
led you to
timing.
it?
What led me to it was that I had been involved with the evolution with Rajan Sankaran over the years. So with the delusion, and it moved into the sensation, etc., etc. So it was a natural evolution, really. I mean, when I say a natural evolution, I can look back at it and say it was sort of just a smooth curve. But in fact, it wasn't, it wasn't necessarily a smooth curve. There was kind of jagged edges to it. But basically, now I look back and it just seems like a smooth, easy, completely natural evolution. One moving just into the next, moving into the next, moving into the next. And I see how they all just come together.
Now they have come together.
Yeah, although I have to say I'm not sure that they ever weren't together.
But there was...
maybe there was an emphasis on one side and an emphasis on the other side, or whatever.
But there was a time when with every new book of Dr. Sankran, the method of practicing of the sensation method practitioners would change. There was a time when everyone was trying to find the core delusion. There was a time when everybody was trying to interpret the dreams.
Yes.
There was a time when everybody was trying to find the vital sensation. There was a time when everybody was trying to classify the patient in specific families. Does it at any point of time hinder or block the basic homeopathy, the reality that the patient remains the same, the remedy remains the same, despite these different forms of or approaches or different point of focus in the treatment of patient?
Yeah, I think what's from my point of view, what's really special about this evolution is that it has been based on and been motivated, I feel, by failures. So when there are patients that a objective interaction in the case, choosing symptoms, giving a remedy, and the remedy works, no need for anything else. But I think we're a kind of a funny group where we get motivated. It seems to me that we're quite an idealistic group, homeopaths as a whole, and we have this love affair with homeopathy. So we imagine that it can. And Hahnemann, I mean, he just talked about this divine science, right? So we're always striving for that. So I think that we're motivated by the not so much by the ones that easily get better, but by the ones you knock your head against and you can't find the remedy, or you do all the techniques that you know, and the patient comes back and is still not better.
And that leads to
And
you
that
to
leads you to rethink, doesn't it? I mean, I think it does for all of us.
Yes.
It leads you to rethink, and how can I rethink? How can I look at this differently? And I feel that's how the sensation method, the core delusion, the vital sensation, all of it, I think was motivated by what about this group of cases that just haven't gotten better, or I can't see it? Or is there a way that I can look at this differently? And I think a percentage of those cases have done, the sensation method has been the answer.
Yes.
And there will be probably something more we need.
What next?
Yeah, what next?
We need to ask Dr. Sangren. Yes.
Yes.
You have come to the academy now, and you have been here since last couple of days. What has been your experience like here?
Well, it's a remarkable thing. I come here and I just feel like in my lifetime to see an academy or an institution or a structure like this for homeopathic learning, it makes me quite emotional. I feel, I can't believe it. It's the quality, the dedication, the mastery, the sort of synergy, so many people together. It's fantastic.
Yes, it's absolutely.
It's absolutely fantastic.
I was just interviewing Dr. Vishpala, and again we were discussing that it's wonderful to see so many people and from different groups coming together, working in a synergy, and it's wonderful to see that this academy is doing all this.
Is facilitating this coming together.
Coming together, yes.
And sharing ideas and moving forward. It's wonderful.
Yes, absolutely. Thank you, Laurie, for
Thank
being with us. It
you.
has been wonderful to
Thank you.